A newborn's ability to eat and digest food is essential to growth and development. Most babies are able to take feedings with the normal absorption of the milk followed by normal bowel movements. Difficulty in any of these areas can be a temporary adjustment or a sign of a more serious problem. The following symptoms may indicate the baby is having gastrointestinal problems. Constipation. Difficulty defecating is quite common in babies, usually caused by complementary feeding, dehydration, or certain medical conditions. Symptoms of constipation in babies are easy to recognize, namely the little one doesn't defecate at least 3 times a week, has difficulty passing stools, and the texture of the stool is hard. In addition, the stomach can feel hard, decreased appetite, feel pain when pushing, and cry every time you are invited to the toilet to defecate. To overcome this, you can give your child constipation medicine. Colic affects some newborns between the age of 3 to 4 months and can be quite stressful for parents. Colic is prolonged or excessive crying in an otherwise healthy newborns. The crying can be quite loud and last for several hours of the day. Colic often begins 3 weeks after birth, peaks at about 6 weeks, and progressively improves by the age of 3 months. The cause of colic is unknown. However, some believe that milk allergy and oversensitivity to gas may be factors that lead to condition. Diarrhea. Basically, as long as the child is still consuming breast milk, formula milk, or semi-solid food, the texture of the stool during defecating tends to be soft. However, you should be vigilant when your little one is defecating too often, liquid stools, or in large quantities. It could be that your little one has diarrhea. Diarrhea in infants can be caused many factors, ranging from parasitic, bacterial, or viral infections, allergy to certain foods or drugs, drinking too much fruit juice, or food poisoning. Bloated. A bloated stomach in a child can make him cry or fuss. This condition is due to the child's digestive tract not functioning perfectly. Children who experience flatulence will usually show typical symptoms, namely the stomach becomes hard, often burps, fussy, and often farts. This condition can be caused by the way your little one eats and drinks too fast and too slowly, drinks from a teat bottle with loss of air bubbles, as well as the habit of sucking an empty teat bottle, eating gassy foods such as broccoli, sweet potatoes, onion, and cabbage can also cause bloating. In addition, there are other conditions that can cause flatulence, such as reflux or backflow of the stomach acid, lactose intolerance. Excessive coughing. If a baby coughs after drinking too quickly, this is typically not a concern and will resolve once your baby is on a regular feeding schedule. However, contact your pediatrician if your baby coughs frequently or gags during feedings. These symptoms may suggest a problem with the lungs or digestive tract.